Welcome to the Residential Movement. I'm your host, Dr. Ashley Maciejewski, a house call dentist with a lot of passion for dental home care. I'm here to encourage, equip, and empower dentists like you to begin offering dental services at the residences of patients who are best served at home. Listen in as we talk dentistry, business, ethics, mindset, and more, and learn how you can become a part of the residential movement. When other dentists find out that I do dental house calls, there's always a lot of questions. One of the first questions I get, especially from dentists who are interested in pursuing dental home care, is exactly what procedures can you offer at someone's home? That is an excellent question. It's definitely one of the first questions that I had when I first heard about dental home care. Well, there's a ton that you can offer at home, and I'll share my most detailed answer to this question during this podcast. But before I share my answer, I want to share 3 of my beliefs about dental home care that inform my answer to this question. Everyone has a different perspective, and here I'm sharing mine. Number 1, I believe that dental home care is not for everyone. Dental home care is amazing and can help so many people who truly need it. I also believe that most patients should be treated in a traditional clinical office setting. That's because that's where they'll find panoramic radiographs, CEREC machines for crowns, and other equipment that you simply can't bring into someone's home. Number 2, I believe just because you can offer a procedure at home doesn't mean that you should. I don't offer root canals at home, for example, because I can only imagine the sodium hypochlorite and all the tiny files flying all over someone's favorite blanket or couch after Fluffy the cat jumps onto my setup. As always, the services you decide to offer in your office or at home are up to you and your judgment. And number 3, I have to be honest and let you know that my answer to this question has changed over time as I've learned new things, and I'm sure that my answer to this question might change again someday too. Akama Dental is evolving as I learn more, so today I'm sharing with you my most up-to-date answer to this question. With all of that in mind, let's begin. Let's first talk about preventive services. Many patients call for a house call without any chief complaint. They just haven't been able to get to the dentist in a while. They just want someone to come over for what they call a checkup, so they're actually calling and looking for preventative or maintenance services. Obviously, we offer those: exams, prophies, scaling, radiographs, fluoride treatment. Remember, you can't offer a pan at home, so make sure these patients understand the limitations of at-home dental treatment and still agree that it's best for them. Next, let's talk about palliative services. Patients, or more often their loved ones, will be calling you, let's say from hospice, and they know that their loved one has many dental issues, but they're primarily concerned with keeping their patient or loved one comfortable. The palliative care offerings include, of course, the limited exam, so you need to be able to diagnose some pathology and make sure you send in the appropriate script like amoxicillin, nystatin, BMX, whatever this patient needs to be comfortable. Palliative services often include enamelplasty, so smoothing broken teeth that are traumatizing soft tissue. This could also include a periodontal splint for someone who has a B-mobile tooth that's bothering them or something like that. So any procedure where you can keep the patient comfortable. We offer removable services, fabrication, repairs, relines, adjustments. This is all pretty simple and easy to do from home. Actually, a lot of dentists in town who do not typically offer house calls have been known to stop by a longtime patient's house for a denture impression or delivery just because it's super simple to do at home while a patient is there comfortably. Akama Dental offers minor oral surgery like simple extractions or INDs. Now, I love extractions. Extractions are my favorite procedure to do. In another universe, I'm an oral surgeon. When the procedure goes well, it's super rewarding. But I've done enough extractions to know that they don't always go your way, even ones that appear to be very simple. I'm really picky about which teeth I decide to take out at home, especially considering how medically complex my patients are. Usually the ones I'll do are periodontally involved or root tips that are easily elevated. I recommend using your best judgment here. Remember, even as a house call dentist, you can refer to an oral surgeon. Next, we offer operative services like resin restorations. I will say a lot of patients decline restorations because they aren't feeling up to it or they aren't able to cooperate. So SDF is a very popular alternative. I've heard of house call dentists running successful practices without offering any treatments that require a high-speed handpiece. Now, I've also spoken to mobile dentists who offer crowns and bridges in the home. Remember when I said to use your best judgment earlier? This is what I'm talking about. Today, I don't offer crowns because my patient population doesn't demand that treatment option due to their health or cooperation status. It's not wrong if you don't offer high-speed services. It isn't wrong to offer high-speed services, and deciding which high-speed services to offer is completely up to you. Even though I don't prep crowns at home, I'm constantly re-cementing crowns. Okay, so the services I spoke about up until this point make up the majority of my appointments. Still, I'm going to list the other types of appointments that I've had and the other services that I offer. Hopefully, this will give you some ideas of what you could offer to people at home. The other services I offer include minor orthodontic with clear aligners like Invisalign, fabrication of occlusal guards, athletic guards, and bleaching. If you want to know how long certain procedures take at home, check out my free scheduling template called A Day in the Life of a House Call Dentist at residentialmovement.com/a-day-in-the-life. Now notice that you didn't hear me list implants, endo, periosurgery, or anything crazy like that. That's because that generally isn't what my patient population is looking for. It's also because those procedures are logistically difficult and risky. As I've been saying, deciding what procedures to offer at home is completely up to you. I hope you noticed that all of the procedures I commonly perform during house calls aren't actually incredibly difficult. A new graduate absolutely has the skill level required to open their own dental house call practice. Any dentist at any stage in their career can offer a lot of value to people at home. Just saying. I hope my answer to this question was helpful to you as you begin to build your dental home care practice. Whether you choose to pursue dental home care or not, you can support those in need of it by contributing to the Home Smile Care Foundation. The Home Smile Care Foundation is a nonprofit organization founded by myself and my loved ones in order to offer financial assistance to patients who cannot afford dental home care. Visit homesmilecarefoundation.org. Thanks for listening today. Please keep these questions coming. I appreciate you. That's a wrap on this episode of The Residential Movement. If you liked what you heard today, subscribe to stay updated and leave me a review. If you know someone who could benefit from this info, please share this with them. All of these actions help fuel the residential movement. Thanks again for listening, Doc. Keep up the good work.